All right, so in this video, we're going to talk about how to assess if we have a senior adult that falls down. We've got a lot of areas in the church that somebody could trip and fall. We've got stairs. We've got that area in the back of the sanctuary where the little bump from the cords, we have people trip on that all the time. So if we have a person, usually 65 and older, that trips and falls down, we need to assess them a very specific way. Hip injuries and pelvis injuries are the things that we're most worried about. So a person falls down, of course, I'm always going to go through my ABCs. Are they conscious? All right. Are you conscious?
Yes.
Yes, so she's awake. She's obviously breathing because she talked to me. Okay, so those two things are good. Now I'm going to ask, hey, what happened? Did you fall down the stairs?
Yes, I did.
Okay, is anything in particular hurting right now?
No.
No. Okay, so that's a good thing. If she says nothing is hurting right now, we're in a good state. Okay, if she said anything was hurting, all right, I would store that in my mind and start working on that. Now, there's a couple of things that I'm going to start assessing because she's 65 and up and she fell down. So I'm going to feel on the back of your head. Okay, did you hit your head at all?
No.
No. Okay. Does that hurt on your neck?
No.
No. Okay, I'm going to feel down your back. I'm feeling along her spine. So I'm pushing on her head to make sure there wasn't any deformities, anything. I'm feeling down the back of her spine. I'm feeling if there's any bumps or lumps, okay? If you feel a bump or a lump and you push on it, ask, does that hurt when I push there? Or say, do you normally have a bump or a lump here? As they get older, when they're getting into their 80s, bumps and lumps on the spine are kind of normal, okay? So I'm feeling down the back, nothing's hurting, I'm not getting any reactions to pain. Once I get down to the hips and the pelvis, this is where I'm gonna kind of push down a little bit. If I get any wince, she flinches, she winces in pain. It wasn't hurting her initially, but as soon as I push on it, that hurts. Now we've got an issue, okay? I'm gonna push on the pelvis a little bit. Same thing, if I get any kind of wince or screaming in pain, we've got a problem, all right? Now, this is her on her side. If she's on her back, it's gonna be a little bit different, okay? I'm gonna have to still feel the back of the head, all right? But now I'm not gonna be able to assess the spine at all. So I'm just going to work my way straight down to the hips. I'm going to push in on the hips like that, okay, with some force. I'm going to push down on the pelvic bones like this with some force. Again, if she screams or yells in pain, we've got a problem. We've got a potential hip fracture or pelvis fracture. Those are going to warrant a 911 call immediately. And we're just going to keep them perfectly still because the stiller we keep them, the less pain they're going to be in. Okay, if we start moving them around, it starts manipulating those fractures and they're in a lot of pain. All right. Now, once I've done this assessment, let's say I pushed on the hips, there's nothing. I push on the pelvis, there's nothing. There's a few more questions that I need to ask. Okay, and these questions are going to get asked no matter what. I'm going to ask her, are you on any type of blood thinners?
No.
No, she's not on blood thinners. That's a good thing. If she answered affirmative, yes, she is on blood thinners, that's a 911 call immediately. I'm going to ask questions like, before you fell, did you feel dizzy at all? Or
No.
did you feel like you were going to black out?
No.
No. Did you lose consciousness at all?
No.
No. Okay, can you tell me what city we're in?
Georgetown.
Georgetown, Texas. Okay. Another funny question, whether you like him or not, who's the president of the United States?
Joe Biden.
Okay. And last question, again, kind of funny, but how many dimes are in a dollar?
10.
10. Okay. These are my altered mentation questions. This is to make sure that there wasn't anything going on upstairs that may have led to the fall. Okay. So these are things to keep in mind if we have somebody that is a senior adult that trips and falls down or falls downstairs or anything like that. That is how we will assess them. And that is how we're going to guide our decision whether or not we can pick them up and move on or we need to call 911. All right. Thanks a lot, guys. Again, like all my other videos, feel free to comment, give me a call if you have any questions, or shoot me an email. Thanks a lot.